in the today's event, when we talk about a smart ventilation, definitely that's not the journey which we started in the beginning. We started in 2017, which actually was the year when we were making waterless solar panel cleaning robots. The idea was basically to help India achieve its dream of solar, which actually was one of the national dreams. We worked with leading companies like Adani Green, Tata Power, Renew Power, and we supplied them the robots, which actually turned out to be a very, very useful solution for them. Then COVID-19 came in 2020, and that is when India was fighting to meet the requirement of ICU beds and equipment.
I'm
The
saying
requirement, the requirement was very simple. It was easy to use and affordable invasive and ICU ventilators, which were required. We developed ICU ventilator in just 84 days amidst the first lockdown, and that could have not been possible if we would have not received support from ministries like DST, Ministry of Health, Marico Innovation Foundation. So we, along with all that support from IIT Kanpur and these platforms, we were able to build ventilator, and we are the only ventilator company which was designed ventilator which was designed during COVID, but is still selling in the market. We not just developed the product and reached out to a few like hospitals, but we made sure that our innovation, which actually got supported from these platforms like Marico, IIT Kanpur, DST, also reaches to the masses. And that is where in the second wave of COVID, we scaled our manufacturing from 10 units to 100 units, and that despite the semiconductor global shortage. And we ensured, due to this, we reached, so these are some of the pictures which tells you what was the scenario back then. Some of the pictures where you see good number of ICU ventilators, just Noccarc ventilators in the line. So this particular is a hospital in Mumbai, Thane precisely. It's a jumbo COVID center and has more than 180 Noccarc ventilators treating patients that at that point of time. So while working with them, what we have been able to achieve is installation base of 3,600 plus ventilators in 650 plus hospitals. The good part is majority of our hospitals are small hospitals where affordability and accessibility to these kind of services were a question. And we were able to do that because we developed 40 plus authorized distributors across India, 70 plus service engineers team, and we are covering 400 plus districts where we ensure that these devices not just reach these hospitals, but also make sure that these devices are operational 24/7 with our helpline and video support and clinical support which we provide. The TAT which we provide in these large metro cities is basically 48 hours, and in the metro cities we provide the TAT of 24 hours and 48 hours in the non-metro cities. The certification which we have been able to obtain in Noccarc is ISO 13485, which is the global certification which is required to manufacture medical devices. Along with that, we also have acquired ICMED 13485. And all the products which Noccarc is introducing in the market are registered with CDSCO, which is the national governing body of India. Some of these things which I would like to talk about, which matter a lot beyond the product. So we have digitized 100% of our manufacturing facility. It might look like a very normal step, but to give you a quantification to that, 150,000 documents in last 2 years have been digitized, which would have been a manual sheet of paper, have been digitized because of this innovation. We are a team of around 100 plus individuals taking care of different functions related to the business of Noccarc, out of which we have a dedicated team of 22 individuals working purely on the products, which is our R&D team. We have filed 23 plus patents so far, and we have a state-of-the-art R&D testing and manufacturing facility, which is basically spread over 20,000 square feet in Pune. So when we actually worked very closely with the medical devices industry, when we worked very closely with the critical care, and we worked with not just with the hospitals, which are the leading hospitals in the countries like Ruby Hall Clinic, the Fortis, Medanta, but when we also work with the smaller set of hospitals where they do not even have the ventilator in the hospital, but they want to actually provide critical care. When we talk to doctors who are actually working with 5 different hospitals and ensuring working as a consultant and taking care of their ICUs, that is when we realize that there are numerous gaps in the critical care area which Noccarc needs to fulfill and which needs to be solved not just by Noccarc but anyone in the industry. And what we realize that the present medical devices, they limit the possibility of critical care. And 3 category is how we define these problems is one around the clinical and treatment. Unavailability of resources and non-adherence to protocols due to processes being completely manual. Capturing, analyzing, and sharing data between nursing staff, doctors is highly inefficient, and it is mostly done through phone or a WhatsApp. There are numerous amount of data. To give you a perspective, in a day's time, 1,200 data points are being captured in an ICU by a single for a single patient, and all these data is actually analyzed to come to a conclusion on the medication, on the device settings. Then second part is the device limitations. Most of the devices have been designed just keeping the clinical functionality in mind, and they only perform A to B tasks. They do not perform anything beyond that. So there's abundant data which is available, but without any context or any information. To give you an idea about that, for example, 85% SpO2 might sound bad for all of us in the call right now because we have experienced that. But in an ICU, what about the history? If the history says that the patient has recovered from 40% SpO2 to 85% SpO2, that actually is a very, very good sign. So there has to be a context associated with the number which actually these devices are talking about, and that right now is lacking a lot. Unfortunately, the last problem, but the majority is part of the majority reason why this is in this scenario exists right now, is the unaffordability and the integration. Most of the solutions which are available in the markets are unaffordable, and these are only compatible with high-end devices. For example, one of the leading patient monitor company in the world, their digital solution does not work with the highest selling patient monitor in India. Unfortunately, for a person to actually get that particular digital solution, they have to pay 80% extra on the devices to leverage that kind of a thing. And most of the solution only solve partial problem and only suited for large corporate hospitals. So this is how we actually see the changes is required. What we believe is the technological innovation beyond clinical requirement. So right now, if we talk about the decades ago, majority of the devices innovations were happening around the clinical side. But right now, it has to be beyond clinical, because the operational efficiency is something which needs to be improved, because the clinical outcome in terms of the communication between the intensivist and the clinician staff, these needs to be improved. And the three areas where the technological innovation is required, one is the digital intervention, where real-time monitoring and digitization needs are there to eliminate manual errors and standardize the workflows. There needs to be a platform which brings together all these stakeholders and reduces the feedback cycle, the communication cycle. There has to be an integration of AI and machine learning to bring context and situational awareness to the data, which actually is being coming out from a medical device, which is only the source of information for the patient health. Then around the device design, there has to be a technological stack which allows device to communicate, connect with the cloud capability, cloud platforms, and also with other devices on the same bed. Right now, there are minimum 3 devices which are there: patient monitor, ICU bed, and a ventilator on any ICU patient. Unfortunately, what happens, it depends on the skill set of the doctor, how to collate all these information from all these 3 devices and process that information to reach to a conclusion. So the importance of communicating these devices with each other is actually very, very important. Then the digital capabilities in devices which allows better interaction and collaboration with the users. It should not be just a device to measure like a calculator. It should actually be a device which is collaborating with the intensivist and the user to provide the care. And affordability and integration comes as the last, but it's one of the most important part. All the solutions have to be cloud-based solution, because the smaller hospitals cannot afford an investment in the IT team and IT infrastructure. All the solution needs to be retrofit design so that the existing ICUs, where they cannot go for a complete revamp, should be able to experience the full digital capabilities. And the devices needs to be a platform-based design so that the functional upgrades, because in the current world, things are changing rapidly. Rapidly, when we say today we have one technology of treating a patient, tomorrow we have another technology of treating a patient. But that is not how we can actually replace these medical devices. So the devices have to be able to evolve to meet these changing requirements, and it should be a platform-based designs. So today we actually are going a step closer to what we are trying to build in this current space. And we have with us, and we are really honored to have Dr. Mashelkar with us, who actually will be introducing this Noccarc V730i to the world and to the country right now. And just to almost everyone knows him. Definitely, we have been following, and he has been source of inspiration for not just budding entrepreneurs, but I believe people who have actually succeeded as well in the both academia and in the business world, in the corporate world. And it's an honor to have you, sir. Just quickly, I would like to give you people who have not been able to go through what he has actually contributed to this country. Just quickly, he needs no introduction, definitely, but giving an idea. So Dr. Mashelkar, he has been one of the longest serving Director General in CSIR after serving as a director in National Chemical Laboratory. He has not just been very instrumental in the academia and the government bodies, but he has also played a very, very instrumental role in the corporate industries, private industries like Reliance Industries, Marico Foundation. He has contributed a lot, both in terms of the R&D and in terms of policies to this particular country, and not just the industries, but also the academia. The way IPR used to be there in India, he has changed policies around that, and he has made them more inclusive. For the work which he has done, definitely the number of recognitions are probably twice than what my age is, definitely. But some of the innovations, some of the recognition which Dr. Mashelkar has, he's the first Indian to win the most prestigious Lenovo Science Prize in 2018. That considers to be the highest science prize by the World Academy of Science. Not just that, he has been recognized by the President of India and been honored with the three highest civilian award which any civilian can get, naming Padma Shri, Padma Bhushan, and Padma Vibhushan. It's our pleasure to have you, sir, today with us. I would request you to talk about what you feel, how this industry is changing and how the smartness can bring. And then followed up, we would love to have you launch the product, sir.
Thank you. Thank you very much, Nikhil, first of all. My very hearty congratulations. This is a very special morning for you. We are unveiling the next-gen smart ICU ventilator. I always say I'm not a great believer in best practice because you are copying somebody's best practice. I'm a believer in next practice, all right, which should become the best practice for others. And therefore, I'm very happy that this made in India for the world, and not just best practice, but next practice, is being launched this morning. That makes me very, very happy. Secondly, my heartiest congratulations to you, Nikhil, as well as Harshit, because I've seen your journey and we like to sort of reflect on it. I remember Marico Innovation Foundation, to which you repeatedly sort of made a mention of. When COVID struck, it was very interesting that Mr. Harsh Mariwala and Mr. Amit Chandra put their own 2.5 crore and gave our Indian innovators a grand challenge to come out with instruments, equipments, whatever the country needed, because we were right in the midst of COVID. We were importing PPEs from China, we were importing diagnostics, and if you remember, many of them had to be returned because of low quality. So this was a great philanthropical sort of initiative from them. I remember we had a very powerful committee, including former Director General of ICMR, Nirmal Ganguly, whole range of other experts, 7 top experts. We received 680 applications and gave finally 6 awards. And I'm very proud to say that you are one of them. And in fact, among the 6, we had rated the 2 most promising, and you were one of them, basically. And I'm very happy because we looked at your potential at that time when you gave the award. Today, we are talking about performance, and you are moved from potential to performance. In fact, you will remember we were asking you for how many did you sell, what is your target, and that time you talked about initially a number of 100 and then a number of 400, and you made them. And today we are talking the kind of numbers that you're showing are staggering. So one feels very happy that happened. And I remember a conversation with Rakesh. He told me how he came in at a point in time. Because many times, you require a mentor. In life, speed and direction both are important. You go with great speed in wrong direction and you reach nowhere. So Rakesh, you played also a very important role. I want to all congratulate you, salute you for what you have been able to sort of achieve. The other point I want to make is that it is always a good practice to displace your own products yourself. Otherwise, your competitors will do it for you. That's what Sony chairman has said. And that's what you have done because your version today, this V730i ICU ventilator, has nothing in common where you started, as a matter of fact. All right. So you kept on doing that, and you will have to again displace this product with even a superior product, more product. So the job is not over. All right. Innovation is a continuous endeavor, so as to say, and you have to do that. The other thing I loved about you people, I always sort of give a lot of importance to that there is always a purpose, perseverance, and passion. Purpose, in a sense, you have a big purpose. It's not just to earn money, all right? That's a side product. Earning money is a side product. Doing good is the sort of main product, all right? And you had this desire that we were all importing ventilators, we're dependent upon other countries. And why can't we do that Atmanirbhar Bharat with Atmavishwas? And you demonstrated that. That I like the purpose. The perseverance, it is too early to give up. Winners are never quitters, quitters are never winners. And I remember, because we are taking detailed reviews with you, so I'm aware of the hard times you had. For example, in getting components during COVID time was very difficult, or your supply chains had broken down. That you don't sort of give up when that happens. So your journey is most remarkable, I would say, besides the product. And I hope that you will write a case study on how you started. One of the things I liked about you was that initially you were doing something else with robots. All right. And then when this pandemic came, you did repurposing, reinventing, so as to say, to use those skills to develop sort of new system. That's what. So there is a lot for our young people, young startups to learn from you. And I hope your case study will be written up. And I hope one day it will become a Harvard Business Review sort of a case study. That's my sort of expectation and my blessing to you. The last point I like to make is that the word smart is very important. And in the digital world, if you are not digitally smart, you are not smart. As simple as that. And therefore, when we talk about exponential technologies, whether it is artificial intelligence or machine learning or blockchain, a whole range of things, virtual reality, augmented reality, how do we make use of these in practice is sort of the issue. And therefore, what you have been able to do by getting rid of all the manual operations, making them not only automatic but intelligent, cooperative, I think is an extraordinarily important point. As a coincidence, I must say that in my mother's name, I have this Anjali Mashelkar Inclusive Innovation Award. This is the 12th year of the award. And all of these you will find are not best practice, they're next practice. And majority of them are digitally smart, by the way. Okay, and you will see, for example, during the pandemic, I always say 2020 was year of the pandemic is what everybody says. I say no, it was Indian innovation, Indian innovators. So like you, there was this Dozy that came up, which was actually IoT sensor-based system which can slip under the bed. And with AI assistance, in fact, you were able to meet 98.4% of the critical parameters, 98.4% accuracy, the critical parameters, 7 of them, basically. And that product actually, because it was non-invasive, because you could do remote monitoring, because it was AI-based, you could actually sense the criticality of the patient, etc. And today it has become a global product. In fact, CDSOP UK has just ordered 5,000 of them. Private hospitals are using them. And you can quite clearly see, with the shortage of nurses, one nurse which could handle 6 can handle 100 now, so as to say, on her sort of dashboard. So, and they were also similar age. They also did something very similar because they were the person who created, the young man who created Dozy, Dandavate. He was actually a vibration analyst for cars. And then he went into microabrasions and created ballistocardiography and used this. Now, car vibrations have nothing to do with Dozy, which is a sort of a monitor, thinking across, etc. So these are all inspiring examples, I would say, in terms of what you all have been able to achieve. I feel extremely proud. I think affordable excellence is the future, because normally affordability and excellence don't go together, and you repeatedly mentioned that. And if it is affordable, it is important for India. But if it is excellence, you will have global markets if you are ahead of the curve. So I once again congratulate you all for what you have been able to do, achieve. And there is a long way to go, not only this product, but your superb talent you have to use for making India a great medtech hub. Thank you.
Basically, we'll just begin with the product unveiling. We would like to have you say, like, once you give a go ahead, we'll just unveil the product.
Yeah, please go ahead.
Thank you so much, sir. Yes, sir. Thank you, sir. Thank you, sir, for using this product. This product will continue. Definitely, take this product to market. Now, I would like Harshit to basically introduce this Noccarc V730i, which is the smartest ventilator, and we'll continue with the agenda for today.
Yeah, thanks everyone, and thank you so much, Dr. Mashelkar, for being present here. It's a real pleasure for all of us to have you here. We have been always hearing about you, great things about you, and finally, I think we have been face to face today, at least virtually. So I'll just take a moment to introduce on how we started on this particular product, on what was the vision behind this product, and with that, so if you look at the V730i, it took us almost 2 years and efforts of almost 30 a team of 30 R&D people at Noccarc. With that, the 3 objectives were that it must solve the gaps of the Indian healthcare fraternity. So like we discussed that there are multiple gaps in the healthcare. It must solve the gaps of the Indian healthcare fraternity. It must be future ready, because when a healthcare physician is investing into a product like Noccarc V730i, they are not just buying this for a couple of years, but they are getting this for the next 5 to 7 years. And in the next 5 to 7 years, there are multiple technologies that change. There are new things that come up. There are technologies that evolve, and the product must be able to evolve with that. That was another objective that we had. And of course, the clinical excellence. So like sir, you mentioned, if it is not excellent, if the clinical excellence is not there, then the product will be limited to India. So that was never the vision, and clinical excellence was again one of the core objectives that we had. And with that, today, after 2 years and after so much efforts, we have the product with us. And I'll quickly introduce on what are the key things that we have implemented in V730i. So right now, it caters to the infant, pediatric, and adult patients, with starting from a tidal volume of around 15 ml and goes up to 4,000 ml. We have used the latest generation linear motor flow control technology, and because of this, we have been able to deliver a tidal volume of 15 ml without a proximal flow sensor, which has happened very rarely across the world. It comes with a 15-inch touchscreen, but the key thing that we have put in a lot of efforts in is the user interface, and we have tried to make it as easy as possible for the clinicians to operate. We have given an ultrasonic nebulizer, which is inbuilt into the machine. So there's no additional cost or no additional hardware which is required to use this functionality. And we have also given a smart humidifier. So we observed that in the Indian healthcare scenario and even global healthcare scenario, humidifier is something which is generally ignored, and the problems associated with humidifier, like we saw black fungus and those kind of things during COVID, were related to humidifiers. So we have made sure that those kind of things are eliminated, and we have integrated the humidifier along with the ventilator. So coming to the future readiness that we just talked about. So on this, we have given a lot of thought on how we can make sure that the investment that has been made on a product like V730i is protected for the next 5 to 10 years. And with this over-the-air updates, this is something. So if you need a new feature, if Noccarc releases a new feature or a new functionality or a new training module, our service engineer does not need to come to the hospital to implement that functionality. It can be just connected to the Wi-Fi, and it is just updated through the internet just by connecting to a Wi-Fi, like it happens in your mobile phones. It is seamlessly integrated with Horizon View, which is Noccarc's own cloud-based platform, which allows you to visualize patient data and patient device, the medical device data remotely through your mobile devices anywhere in any corner of the world, on your mobile phones, on your laptops. And our belief is that this thing will be the leading. This is a leading step towards telemedicine in India and in the entire world. This will be a key enabler in that. Then we have also given certain expansion slots. So the idea was that we didn't want the V730i to evolve just in software, but it should also evolve in hardware. And that is why we have given 4 expansion slots. And if there are, and there definitely will be new technologies and new modules which will come up in future from Noccarc and from third-party manufacturers, which will be integratable in the V730i without any additional investment. To do all of this, we have given a very powerful 1.4 gigahertz processor inside the V730i today, and a revolutionary Noccarc operating system, which will make all of this possible. And we make sure that the device hardware is powerful today itself to evolve into all of that we are talking about. Into the clinical validation aspects, again, now this is a ICU ventilator, and the clinical outcomes is the most important aspect of any medical device. Ultimately, it has to treat a patient, and it has to make sure that the patient is treated as soon as possible, removed from the ventilator as soon as possible. To do that, we have used the Ingmar ASL 5000 lung simulator, which is the best lung simulator available throughout the world. And because of this device, we have been able to test multiple conditions in a reproducible and repeatable manner. So we have been able to analyze 100 plus physiological parameters with multiple changing patient conditions. We have been able to simulate a very wide range of patient scenarios. So more than 35 patient conditions, patient models, lung conditions, disease conditions. We have been able to mimic multi-condition patients as well because of this device. And if we were to do all of this on physical patients, it would have taken us almost 10 to 20 times longer time, as well as a lot of patients. And then too, we will not been able to do this in a repeatable manner. So this is where we benchmark the V730i, that it has to be effective on all such conditions, and we have made sure that the V730i is effective on each and every known condition which exists in the respiratory diseases. So it's not just the simulations that we have done. We have also done clinical validations with 2 of the best hospitals in the West, which is the Symbiosis University Hospital and Research Center in Pune and Ruby Hall Clinic in Pune. And another thing that when we started designing the V730i was that the vision of Noccarc was never limited to just India. We always wanted to be to take Indian innovations, Indian products to a global stage, and make our products at par or even better when compared to global products. And that is why from day one, we were very clear that we will comply with all the requirements of CE mark, which is the European Union's guideline for medical devices. And our CE mark is under process, and very soon we'll be launching our products in Western markets as well. So with this, I'll I'd like to thank Dr. Prachi Sathe, who has been instrumental in helping us doing all these clinical evaluations, both on the simulation aspect and on the patient aspects. And while she is not present here today, but she has given us a video testimonial and a video message that we would like to show to all of you, and to look at her on her opinion on what she thinks about smart medical devices and the smart future of ventilation.
Namaskar. We all have gone through COVID and various challenges we have faced together as medical and non-medical and various other field specialists as well. But as medical specialists, especially working in the intensive care, the biggest challenge for us was to give respiratory support to patients who were undergoing COVID. The national statistics showed us that there would be something like 40,000 ventilators all over India, which would be able to cater to respiratory failures created by COVID, which would not be catering to even 1/10 of patients, which were estimated to come up during COVID epidemic. And that is where the government started encouraging various industry houses or various innovators to come forward to develop indigenous ventilators, because obviously that was the time which was global shortage of ventilators. So we could not have imported, which is our usual practice, to import the high-end ventilators for ICU ventilation. And then various industrial houses started coming up with various ideas, right from basic machines which could push air into the lungs, and that's it. We in the ICU started getting these invitations to discuss with them, and then we realized that the understanding of ICU ventilators is very scarce in the society or in the industry. So we decided to make a small video which would give the characteristics and the requirements of critical care ventilator, which we floated on the YouTube. With that, I think a lot of groups came forward who got insight into development of this. So in this, we came across a group of bright engineers from IIT Kanpur who had founded their innovation under the name of Noccarc. They came up with sincerity and persistence, and they really put in a lot of effort. And whatever ideas we gave them, whatever requirements we gave them, they would make sure that they were integrated next time when they will come further to ask us the advice.
I'll get it here also.
So during this process, it was such a satisfying process that we were doing something for the patient which is going to be useful in the near future. V730 was the first ICU ventilator which was completely indigenous. Noccarc group could develop in 90 days. That is a record time. And that was the time required for n number of ventilators, because the patients were just falling in onto us in the ICUs. And it so happened that one particular day we did not have a ventilator to ventilate a patient, and new ventilator 310 was at hand, and we could actually save a life of a patient by using it. That gave us a lot of confidence, and then we started using it. But before that, a lot of process had gone into it before we could use it on the patient, and I would like to highlight that they had come up with a lung simulator even at that time, and we would put the ventilator in the ICU, not on the patient but on artificial lung, and 24/7 we would keep on charting the various parameters which ventilator could be delivering, and whatever problems we could face, we were reporting them back to the team, and they were very prompt in correcting those. It so happened that before putting it on a patient, we had to check how it actually delivers, and I'm feeling so proud that one of my registrars in the ICU actually, with a sterile circuit, put it in his own mouth and he tried to breathe through the ventilator. And only when it was found to be satisfactory, we could put it on the patient. So thus, it came up a long way after our validation, multiple units, were installed in multiple ICUs all over India, and it was a proud feeling to have an indigenous ventilator. As a person working in ICU for more than 25 years, it always was at the back of my mind about the cost of saving a life in Indian ICU, because most of the technology which we would use was imported, and our patient who would come from any socioeconomic class would actually have to pay in dollars for surviving. Because he could not afford it, there would be outcomes which were otherwise. And that used to hurt me a lot. And that is why our team was wholeheartedly supporting Noccarc team. So now thankfully COVID is over. But that does not take away the requirement of a real high-end ventilator or a respiratory machine for ICU patients in India. With that, it was a good thing that Noccarc Group came up with unrelenting efforts to develop a real world-class ventilator. Not only world-class, even more futuristic, which would surpass the requirements or the gaps in existing ventilators which are available in the market. That was a very good idea. Because all said and done, artificial ventilation is artificial. It can never match the natural respiratory efforts or the physiology. And that is why patients are always uncomfortable on ventilator. And we are always trying to minimize the time for how long the patient should be on the ventilator, and earliest possible we want to wean the patient off from the ventilator. So for these reasons, there has to be modification of the modes of ventilation which would go more towards adaptive and autonomous, which would recognize the patient's requirements and adapt themselves to that. Man behind the machine is always important, no doubt about it, but it cannot be every minute by the bedside of the patient. And that is where the requirement of this technology is there, which will help us to improve the outcomes in ventilated patients and reduce the complication rates or ventilator induced complications as well. Another important thing is that these ventilators in current times are standalone machines. They are not talking to other monitors, they are not talking to lab or various parameters which we monitor for the patients who are being ventilated, for example blood gases, carbon dioxide levels or nutrition requirements, or sometimes even muscles, how they are functioning in a patient's body, because if the diaphragm is not functioning properly, it is not possible for the patient to come off the ventilator, for example. So development into this direction would require integration of the respirator or the ventilator towards all other electronic systems or monitors or digitization. We are entering into the digital era, we are saying, in India. And this requires a lot of integration of data. With this idea, the record keeping of the patients also is going towards electronic. But it is very, very complex for a patient who is in the ICU where like hundreds of parameters are being monitored. And the nurses also lose a lot of time in charting those. Plus, for the integration and interpretation and including it into the decision-making tree requires a lot of effort. So if something like this can be developed, it is going to be of great use, great help to the doctors or intensivists, as we call them, who are working in the ICUs. With this idea and internal discussions between our ICU team and the Noccarc engineers team, they came up with a solution for our ICU charts called Horizon View. And this integrated digital data of all ICU patients with n number of parameters can also talk to the ventilators is the whole basic idea. With this, I think the ventilator which has been developed called V730i will go a long way. It will really raise the bar in international market. I am very sure it will make a difference in the ICU patients. For this, of course, we have to take proper scientific steps to validate it. During COVID time, there was so much of a need that we had to rush in validation and utilization. So now we are going to we are in the process of doing this validation according to CE mark requirements, which is using EU directives, that is European Medical Device Directives. Accordingly, we are checking this ventilator on a standalone lung simulator. Lung simulator can create a lot of clinical scenarios. Not only that, whatever in Indian scenario, for example, we want to generate clinical scenarios can be inculcated in this simulator as well. So we can check on various possible clinical scenarios whether the machine is functioning properly and is not dangerous to the patient. After this, with ethical review board's permission, we are going to use this in clinical patients. With this, I think a person like me would feel very safe to accept V730i ventilator as a real critical care ventilator in India.
You not only brings the wisdom of this industry from the clinical side, but definitely it bridges the gap between what an engineering and a doctor that gap is actually filled in the organization because of you. Thank you so much for that. And I think we completed the agenda of the today's event. And before we conclude the event, I would like to thank firstly the team, which actually made sure that this kind of a product was not just dreamt of, but also built in our country, where people have been completely dependent on import. So thanks to our team members of Noccarc for ensuring that this product is live and up and running in the market. Thanks to our mentors, Rakesh Bhargav sir, who actually took out time. He actually is in the US, but he still ensured that he is available with us today in the event to make sure that today's event is a success. And Sanjeev Verma sir, he just had to leave. And IAN and IIT Kanpur for being part of this innovation and for part of our Noccarc journey. And again, Dr. Mashelkar, who actually is definitely not just a person who we look up to, we get inspiration from. He has actually transformed India to a level that the benchmark, which has been set for any innovator in the country to do any change, is actually very high. And thanks, Dr. Mashelkar, for being part of this event and introducing a smartness to the critical care. And again, lastly, thanks to everyone who actually joined us from the YouTube channel and being part of this unveiling event of V730i, the smartest ventilator in the world. Thank you so much, everyone. And for any product related information, you actually see the information, the contact information on your screen. You can reach out to us on the website and the email and contact us on the toll-free number, and we'll make sure that all the information which you need related to the product is available to you. Thank you so much.
Thank you, everybody. Wish you all the best, Nikhil and team. And
Thank you
good
so
day
much,
to
sir.
all of you.
Thank you so much, sir.
Thank you, sir.